Good afternoon, everybody. My name is Cheryl Chen. I'm from National Taiwan University, and it's right now it's 5 a.m. in my time. So if I didn't say something appropriate, please forgive me. And you can all come forward because this has come out a little bit smaller than I expected. I think delirium is the impact of delirium is well studied, including a higher chance of the death in 6 months and 12 months after the ICU admission. And however, recent study also show that the delirium people also have a higher ICU mortality. But even they survive after the ICU discharge, many of them are actually developing ICU acquired weakness. A lot of them have symmetric generalized muscular weakness along with them. So in this study, we are interested to know whether the impact of ICU acquired delirium and ICU acquired weakness on 3 months mortality. And what we do is we compare 3 months mortality for 4 survivor groups of critical illness. So for example, we do normal, people who doesn't have ICU acquired weakness, people who doesn't have ICU acquired delirium during their ICU stay. And we do one group is delirium only. They don't have weakness by the time when they discharge from the ICU, but they does develop delirium during their ICU stay. The other one is weakness only, and the last one is delirium and weakness. Those people who actually have delirium during their ICU stay, and by the time, although they survive the ICU stay, they have screened as ICU acquired weakness by the time they discharge from the ICU. This is a single-center prospective cohort study. We do consecutive delirium-free patients who are admitted to our ICU, 6I medical ICU in our hospital, and we evaluate, we screen their delirium status over the 40 days, during their ICU stay. Participants who survive and discharge from the ICU were assessed for their weakness by, measuring their muscle strength in 6 bilateral muscle groups and using the medical research counselor scale. And some score below 48 were designated as ICU acquired weakness. That's how we screen for ICU acquired weakness. And the outcome, like I say, is all-cause mortality by 3 months. Okay? And here comes the result. I think just quickly give you some, the group. The first group is normal. We have 124 patients. The second one is delirium only, which includes 69 participants. For weakness only, we only have 17 people. For people who have both delirium and weakness, for their ICU stay, actually we have 38. And just looking at this, you can see, people are generally slightly younger for normal people, as expected. People actually are different compared to their body mass index and also their ICU diagnosis. Their SOFA score is actually different among the group. And the ICU length of stay is significantly different among different groups. As expected, I think normal group has the lower length of stay, comparable, significantly different. And if we look at the survival for the initial purpose, I think the normal group is the black line, delirium only is the blue one, ICU acquired weakness is orange, and then delirium weakness is the purple line. And as you can see, 4 groups are actually significantly different. I think a lot of them might be expected that people in the delirium and weakness group are actually have the worst mortality. So if we put that into our regression model, as you can see, for 3 months mortality, the odds ratio for their 3 months mortality death compared to people with doesn't have delirium and doesn't have the ICU requirement. So the result of this study showed that we do have 43% of participants in our total study have delirium during their first ICU stay. And we have 22% screened as a weakness by their ICU discharge. And together, look at those models, we find that neither delirium only nor weakness only was associated with a higher 3 months mortality. Because although odds ratio is a little bit higher compared to 1, but it's not reached significant levels. Okay? And participants who have delirium and weakness actually have a 3.724 higher risk of death compared to those without delirium and those without weakness during their ICU stay. So coexisting delirium and weakness actually pose an increased risk of death 3 months following their ICU discharge. So just for this, I think we do have a screening mechanism and also the new preventive therapeutic strategy to combat the combined effect of delirium and weakness acquired at ICU because they are very highly, prevalent. So that's my study. I will then happy to entertain any questions.
Did you assess weakness before ICU admission also?
Well, because all the ICU admission usually are emergent, so we don't have the opportunity to screen for ICU acquired weakness. But we do ask whether patient has weakness before the ICU admission, by history taking. That's all. And all those actually are, independent before their index hospitalization and index ICU admission. So that's a very good question. Thank you.
So a question I have is, do you think that it is just because these patients are just more ill? I mean, they're older, they're more critically ill, their Apache scores are higher, they're on the vent longer. Is that why you're seeing the increase in mortality by 3 months?
Well, obviously that's a possibility. But at least delirium and weakness is a marker that if we identify, maybe there's something we could do about that.
Okay.
Yeah.
And then how did you measure your outcome at 90 days? Do you use a medical record or how do you do that?
Medical record plus family interview.
Oh, okay.
Sometimes you will miss something.
Sure.
You only do medical record.
Okay.
So we do, call back and all the patients have been followed for a year in terms of their functional status, cognition, and also their mentality.
Great. Sounds good. Thank you.
Sure. Sure. My first sort of comment is because this variance really is so small,
Yes.
it's not a degree of insight. I'm not sure that you're actually powered to make this other than that delirium and weakness seems worse. So I would suggest to you as statistician about the best way to package this data, given the low impact.
Sure.
The second question I have for you though is more of a how do you think weakness and delirium interact with one another in terms of physical therapy compliance?
Well, that's a very good question. That's also, one of the possibilities. You know what, in our study, because that's a difficult answer question, we don't know for sure, unless we study that. But at least in this study, we find out that people have the delirium actually have increased risk for weakness. The odds ratio is probably like 4 to 5 times.
Do you think that's because they are doing fewer physical therapy visits, or would that be something you could pull from your data?
I think it's definitely possible. People have less opportunity to be active. They be sedated longer term, they have less opportunity to be treated. So that's a possibility, but we will look into that. We don't have the data yet, so thank you for the question. So,
Yep, the big one.
Oh,
There you go.
sorry.
Great. Thank you.
So,
Okay.